Hey everybody, it's Catie Harris, and I'm here with Jordan Rodriguez from Evexias to talk about hormones. I'm very, very excited for this lecture. And, Jordan, and Lee Klein is here with us as well. So, hey, thanks for joining us, Lee. So, Jordan, go ahead and take it away. Tell us about you and what we're talking about tonight.
Yes. Hi, everyone. So, like Catie mentioned, my name is Jordan Rodriguez. I am the district sales leader for Evexias Health Solutions in the state of Florida. And then, like she mentioned, we do also have Lee Klein. She's up in the Northeast area, also another one of our lovely representatives. But, you know, this month is all about menopause. So, we are going to really have a key focus of menopause and really correlating why hormones matter so much, because as we go menopause is our hormones. I mean, there was just a podcast I listened to with Terry Denai and Dr. Laval that says our hormones are who we are. And when our hormones are out of whack, we are not the same individual that we could be. So that's kind of what we're going to be going into today. So I'm going to go ahead. Hopefully, everyone can see the screen okay. But really, what we're focusing on is what you need to know about hormones. There are tons of myths and misconceptions out in the healthcare world about hormone optimization, about whether that's testosterone or estrogen or thyroid or whatever that may be. There are a lot of myths and misconceptions. So we're going to be kind of debunking some of those today. And then we're also going to go over what are kind of your options. I always like to tell people that aging is optional. I hate the word aging because I think that really technically we don't have to age because there's a lot of different integrative therapies and well documented and well researched therapies that have been around for decades that point to the efficacy, and hormone optimization is one of them. So we're really going to be doing a 10,000 foot overview of what hormone optimization is, what symptoms are associated with it, and then what are your options if you are someone that is a candidate in dealing with these issues. What are your options to get those hormones replaced? So first things first is we're going to start very basic. What are hormones? So hormones are the chemical messengers that give our cells and organs the proper instructions to keep us healthy. Essentially, they are sending the signals and they are sending the instructions that tells our organ systems or our thyroid or our receptors to do certain things to keep us healthy. As we age, obviously a lot of that starts to decline and we have less hormones to actually come into our cells and protect them. So I love to use the analogy of using our cell phones, where in 2024 everyone and their mothers have an iPhone or a phone that they are glued to on a consistent basis. We can't live without it. That's how we send our messages. That's how we receive our messages. That's how we get from point A to point B with the GPS is our cell phones. So when we don't have that central powerhouse to send and receive those signals, we are not operating the way that we should be. So what we're talking about today specifically before we kind of go into all this conversation is bioidentical hormones. When we talk about hormones in general, there's a lot of misconception about anabolic steroids, and that kind of plays into the world with hormones, or synthetic hormone replacement therapy, which our body just does not recognize and it doesn't produce. So we're going to go into a couple of that here shortly. But really the main hormones that we're talking about today, especially when it comes to a female and menopause related symptoms and issues that we deal with, is going to be testosterone, progesterone, and estrogen. Those are the powerhouse hormones. And of course, we have the thyroid hormone, and vitamin D is a hormone, and those are some massive powerhouses as well. But today's conversation is really focusing around the key three that really help us prevent chronic disease, mitigate symptom relief, and things like that. So those are the kind of the real ones. Now, when we talk about symptoms, I kind of want to keep on the slide for a little bit. Do you suffer from or have you experienced? I know that a lot of people on this call have probably dealt with extreme fatigue hitting 3 to 4 p.m., which means you've hit a wall in the afternoon and you are ready for a nap, and you could go to sleep all night and wake up in the morning. But the problem is you wake up at 3 to 4 a.m. in the morning and you can't go back to sleep, and now you have a full day of work. Then you have cognitive issues like anxiety and maybe some depression, and maybe you have trouble focusing, or maybe some brain fog, or maybe irritability. So then we kind of throw in some mood concerns with that, memory loss, weight gain. So a lot of us females, especially when we hit perimenopause, menopause, postmenopausal, is we have that estrogen belly. All that inflammatory estrogen is just hanging out there, and we wonder why we can't lose the weight. joint pain, migraines, low libido. And I mean, the list just goes on and on and on. And we don't correlate that with hormone optimization and or hormone deficiencies. So really what we focus on and what we train our medical providers is to really screen for these issues, but then draw the comprehensive labs to get to the root cause of what is causing these issues. So just a couple facts about menopause. You are considered to be in this part of life 12 months after your last menstrual cycle. So your ovaries actually decrease the production of testosterone, estrogen, and progesterone. And testosterone for a female is actually the very first hormone to stop its production well before estrogen and progesterone are depleted. That is one of probably the biggest myths that we hear all the time is, oh, well, testosterone is not a female hormone. Males, that's a male hormone. I'm going to grow a beard and, I'm going to turn into a man. I'm going to get bulky. I'm going to fly away like Superman. That is just simply not true. When it comes to testosterone optimization, we have testosterone receptors. The most abundant receptors are our testosterone receptors. And so we really lack that hormone when it comes to females and actually allowing testosterone optimization to happen for us females because of all this myth and misconception that's in the kind of marketplace. So when we talk about menopause too and chronic disease progression, when we have a decline in our estrogen, our progesterone, and most importantly, our testosterone, we start to see a lot of chronic disease increase. Meaning when we have less hormones to again go in and protect ourselves, that's when all these little guys, or really not little, but all these chronic diseases start to progress and just get worse and worse and worse. So osteoporosis specifically, even for females, 80% of osteoporosis patients are females. Well, we got to ask the question, why? Why is that? Because when a female goes through this transition of, again, perimenopause, menopause, postmenopausal, we lose on average 25% of our bone mass because we have a decrease in estrogen, a decrease in progesterone, which works synergistically with each other to help keep bone healthy. So when we look at the onset of menopause to about the age 60, like I just mentioned, women lose on average 25% of their bone mass due to the loss of those main hormones. And because females lose so much estrogen and so much progesterone, menopause is a sex-specific risk factor for osteoporosis. I mean, millions and millions of patients deal with this chronic disease, and it's something that we may have been able to prevent. And when we look at osteoporosis too, the 60-year-old or 70-year-old female that goes out and has a low bone density and falls and breaks her hip, that patient is going to have a very hard time getting back to any type of quality of life. They're at a point where their hormones are not helping them, not working for them, right? But also, when you're at that age and you're breaking bones or you're breaking hips or you're having a fracture, it's so hard to get back into that daily operation of life like you were before that happened. So our key point about hormone optimization is really focusing on prevention. And then when we tie that in with menopause, we should be starting this prevention process beforehand. We should be screening this in our 20s, in our 30s, and as we make that transition so that we can get ahead of it and minimize the effects and the symptoms that plague us on a different daily basis. And then we look at cardiovascular disease. So you hear all the time, oh, hormones cause breast cancer and hormones cause blood clots and strokes. And we're going to get to that later into this presentation as to where that kind of came from. But when we look at cardiovascular disease, 5 times more women die from heart disease than they do breast cancer. That is startling. More people die from heart disease, 5 times more people die from heart disease than they do breast cancer. So when we talk about cardiovascular disease and menopause and cardiovascular disease and just females in general, females don't really understand the risk that they're at, especially when they are going through that transition of life. It's the number one killer in women. Those who started a hormone saw a 50% reduction in cardiovascular disease. That is a startling statistic. Just by optimizing your hormones and getting them into an optimal range, we saw a 50% reduction in cardiovascular disease and really all-cause mortality. So I think we all know one of our biggest hormones is estrogen. Estrogen sometimes can have a bad rap, right? Because it goes back to a lot of the misconceptions about just hormones in general. But did you know that 17 beta estradiol is really the main form of estrogen that we're talking about and we really focus on? It has over 400 functions within the body. So it does maintain a lot of sexual function in both male and females. So when I go to the male side of things, I know this is more menopause related, but another misconception about hormones and when it comes to blocking estrogen in men, men need estrogen just as much as females. Now, we're not replacing estrogen like we would as far as a female. Men naturally convert and metabolize from testosterone to estrogen. So we never want to block that because it plays so many roles in cardiovascular protection for both male and females, sexual function. So if you're a female that deals with painful intercourse, dryness downstairs, maybe you just don't have that libido or you can't reach an orgasm like you used to, whatever that may be, estrogen helps regulate sexual function in both male and females. And it's such an important hormone for cardiovascular protection, to keep our bones nice and healthy, to keep our mood nice and regulated. That's what I like to call our happy hormone. So when we talk about decreased estrogen, we look at the symptoms associated with that: hot flashes, anxiety, depression, like I've just mentioned, dryness down there where it hurts when you try to have intercourse, mood swings, infections. If you're someone that is prone to yeast infections or BV or some type of bacterial issue, that could be directly correlated to a decreased level of estrogen. Joint pain. So going back to the bones, our estrogen plays a massive role in just keeping our bones nice and healthy, keeping our joints, our ligaments, our tissue where it needs to be. As far as skin, estrogen has a direct effect on how our skin is. Collagen production, the plumpness, the glow, and the new kind of skin that we can produce when our body is signaling that to happen. Like we mentioned, decreased bone mass, bloating, and memory lapse. So we've already talked about testosterone. We've already talked about progesterone, or we haven't gone too much into testosterone, but we'll get to that here in a second. But we've talked about estrogen. Now we're going to go into progesterone. So estrogen and progesterone, they work synergistically with each other. And so they work synergistically with bone health, but also keeping just your overall whole body health. So your lipid panels, cholesterol, things of that nature. So progesterone is produced in the ovaries. And when you're in menopause, you go to zero and we've got nothing. And so progesterone is a massive compound and a massive hormone that helps regulate sleep. It helps reduce fluid retention. So if you're someone that naturally holds fluids, this is a great natural compound that will help actually reduce some of that. Bloating, headaches, bleeding, fibroids, things of that nature. Progesterone actually moderates many effects of excess estrogen, which can cause some of those things. And then progesterone receptors are found throughout the body. It's not just the uterus. Like I mentioned, we have testosterone receptors from the top of our head to the bottom of our toes. Same with progesterone receptors. They are found throughout the body. And you need progesterone even if your uterus has been removed. And really that is, again, going into another misconception is, oh, I've had a hysterectomy. I don't need hormone optimization. I have all these symptoms. I now don't have the parts that used to be able to help me with regulating a lot of what is now out of whack. When you've had a hysterectomy, there are still options for you to be optimized and still live a good quality life. So that is a massive conversation to have with a provider who understands how to actually help you with that treatment plan. So going into some progesterone functions, like I mentioned, it can help act as a natural diuretic, which is pretty awesome. It balances blood sugar levels, increases metabolism, and it actually helps promote weight loss. It stimulates new bone production, enhances the action of our thyroid hormone. So we're not talking about thyroid too much tonight because I think that deserves its own webinar. But the thyroid hormone is a massive hormone that helps regulate metabolism, energy, how our hair is feeling. If our hair is feeling very thin or falling out, we should be looking at how our thyroid is our thyroid is functioning. It does help alleviate depression, reduces anxiety, so it has a lot of mood benefits. And then I think one of the most prevalent benefits it has is it promotes normal sleep patterns. So typically when someone is to get optimized or go on to a treatment plan to where they are doing some type of hormone optimization, if they're having sleep problems, micronized progesterone is a valid option for them to help promote natural and normal sleep patterns. We're not Ambien deficient, right? Our body isn't saying, give me Ambien, give me Ambien. Our body is lacking the proper receptors binding to each other so that they can do what they're supposed to do. So going into some of the testosterone facts, like I mentioned early on in this presentation, is, testosterone is just as much as a female hormone as it is a male hormone. It's present in males. It's the most abundant hormone. And women ages 20 to 40 will lose up to 50% per year. That is, again, another startling statistic, because when you really look at our healthcare and our current American population, when you go and check comprehensive labs on a 19-year-old, and I'll use my brother as an example. I mean, he is only 19 and his total testosterone level was 550. As a 19-year-old, he should be up in the 800s, 900s, 1000s, feeling phenomenal. But he deals with all these different symptoms, and that really comes down to the hormone disruptors in our food, the toxic air we breathe on a daily basis, drinking water bottles out of plastic, using plastic Tupperware for your food, the body wash you put on, the shampoo you use for your hair, all has hormone disruptors. And these all play a direct role in how rapidly we start to decline in our hormones. And that's when we're in trouble. One thing that I always like to say in this presentation is if there's one thing to take away from this presentation by the end of it, is always remember the 3 B's when you're talking about bioidentical testosterone optimization and bioidentical 17 beta estradiol optimization. It's brain protective, it's breast protective, and it's bone protective. So when we go further along in this presentation, we talk about the Women's Health Initiative and the study that used synthetic hormones that pointed to all of these adverse effects, is not the same as bioidentical hormone optimization therapy. They are 2 completely different things, and we'll get to that here shortly. So some of the benefits: who doesn't want more increased energy? Who doesn't want enhanced sleep? Who doesn't want feeling just good overall, that extra pep in your step, enhanced libido, heart protection, bone protection, brain protection? You build lean muscle mass. If you're someone, again, that's been having a hard time with losing the weight and keeping muscle mass on. Muscle is the currency of aging, especially when we hit menopause and we start to have less hormones going in and protecting us. We lose our lean muscle mass, and muscle mass is directly correlated to the aging process. So when we can keep muscle on, you're going to automatically feel better, feel stronger, have increased energy. And then, of course, you get all the other additional benefits of reduced anxiety, reduced irritability, cognitive clarity, improves depression, reduces brain fog, helps with your cholesterol levels, and really balancing that out. Again, we're not Ambien deficient for sleep. We're not statin deficient. We are not Adderall deficient. These meds that we are, sometimes prescribed, not saying that it doesn't have a place in the healthcare world, but we're not deficient in that. We're deficient of nutrients. We're deficient of our hormones. And we really got to look at the root cause of those issues first and see if typical traditional intervention is a part of that treatment plan. So before we go into, okay, I'm a candidate. I've seen that all of these, symptoms correlate to me, but they also correlate to every single patient that's walking through my door when it comes to someone that's in perimenopause, full menopause, and postmenopausal. But when we talk about the Women's Health Initiative, this was the study that was on the front of Times Magazine in the early 2000s that really gave hormones a bad rap. And the reason why is because that study said that you were going to have increased risk of breast cancer, blood clots, strokes, heart attacks, all the things. I'd be scared too if I saw that. But unfortunately, that was misinformation. That was misleading. That scared an entire generation of women off of their hormones, which resulted in 96,000 additional, or 960,000 unnecessary deaths from this when this happened. So the Women's Health Initiative, the study that they were looking at is the synthetic hormones that were being used, which was progestins, which is a synthetic progesterone. Our body has progesterone receptors, not progestin receptors. And then it had conjugated equine estrogens, which was synthetic estrogens. So it's not 17 beta estradiol, which is exactly what our body naturally produces. So of course, when you're introducing these type of synthetic products into the body, of course we can have these type of adverse effects of increased risk of breast cancer, blood clots, and strokes, because our body doesn't recognize that. And if you guys didn't know, conjugated equine estrogens is actually derived from horse urine. And they're still prescribing that to this day. So a lot of what we teach on with Evexias Health Solutions is we really go through breaking down all the literature from the 1930s to the current day across all categories. So thyroid optimization, testosterone optimization, progesterone, estrogen, debunking all of this with the increased risk of blood clots and strokes and breast cancer, so that you can really truly understand the medicine and the studies and the research that's actually out there. And then we actually kind of give you all the business solutions on top of that. But kind of going back to the Women's Health Initiative, I think one of the most disheartening parts about this study specifically is fast forward to 2017, they came out with basically a press release saying the following. A principal investigator of a landmark women's health study says initial results that linked hormone replacement therapy to breast cancer and heart attacks were misleading and distorted for publicity. And so essentially, they said, yeah, by the way, that that study in the early 2000s was not quite accurate. We really didn't have it right. So, those 960,000 deaths, sorry about that. There's a lot of data that's pretty much pointing to the safety and the efficacy when we're talking about bioidentical hormones. And now you see a lot of providers really embracing that type of medicine, but most importantly, doing their own research, being their own healthcare advocate so that they can provide their patients a good quality medicine to actually get to the root cause. So it's unfortunate that this came out in 2017, but then, we are fortunate, right? Because now it's really pointing towards the safety and the efficacy of bioidentical hormone optimization. So we'll end off the conversation with, okay, so again, we know that my patients are dealing with a lot of these. I have a lot of candidates. What are my options to actually deliver the hormones for someone that is dealing with these issues? So you kind of have your two categories, like we've been talking about this entire time, is you have your synthetic column and you have your bioidentical. Your synthetics are going to be pills, patches, and injectables. And then your bioidentical, you still have bioidentical oral methods. You have patches, you have creams, you have gels. And then something that we really love and kind of our bread and butter is pellet therapy, which is one of the more superior options when done right. And we'll go into why the Evexias method is different. So really kind of start with patches. I think patches are definitely a more well-known form and delivery method for hormone optimization. Estradiol levels are better than pills because they are absorbing that. They're not having to do, first liver bypass and break down that oral, but it's not quite as good as pellet therapy. You can have adhesive problems. I've seen it a lot with patients and individuals having really sensitive skin, and that adhesive actually creates rashes and irritation, and they really can't do the adhesive due to that. Another thing is it needs to be changed throughout the week, which some people are pretty good with compliance. A lot of people aren't. And then you actually do have the compliance concerns of, okay, did I put my patch on? Did I miss a day with my patch? So sometimes compliance can be a little not as good as some of the other options. And then 45% of people don't even absorb the hormones through the skin. So depending on if you're putting that on a wrist, or maybe you're doing it in an elbow, or maybe you're doing it inner thigh, or maybe you're doing a labial application, depending on where you're putting that, or not patch, this is going to be for more creams and gels, but patches specifically, you're going to do that more on the glute, maybe on the arm, inner arm, something of that nature. But when we talk about creams and gels, that's something, again, where you can rub that more on the inner thigh. You can maybe do that on a labial application. Labial application, I feel like, is the most recommended option just because it has the best absorption rate, the most vascularity, just because of the thinner tissue there. Now, again, you have to rub that in 1 to 2 times daily, so very inconvenient. It does have a short half-life, meaning you rub it in, it's good for maybe 4 or 5 hours, and then you have to reapply that in order to get that same benefit. It can have bad absorption, like we just mentioned. And I think one of the biggest things is it can actually transfer to others. So if you are a grandparent and you have your grandbabies running around, or maybe you have a little fur baby running around and you do put it on your arm and then you go and hug your grandbaby, that can actually, if it's not completely dry and absorbed into the system, that can now transfer to someone else. And so we want to be sure that if a testosterone prescription or an estrogen or progesterone cream or gel is prescribed to you, that we're keeping that specifically to you. So it can have some issues with that, but there are some pros based on what you feel would be best for you as an individual. Most importantly, when we talk about estriol, which is another form of estrogen, so there's 3 types of estrogens. You have your estriol, your estrone, which is extremely inflammatory, and that's what kind of sits on our belly, our midline area, and gives us a nice little, pouch right there. But then you have your 17 beta estradiol. So when we talk about the estriol form, that does not protect the bones, the heart, and the brain like 17 beta estradiol does. And that's the main hormone that we focus on optimizing. Another option, injections. I probably should have taken this screen out because really injections are not the best fit for females. It's not widely studied in females. You have kind of this roller coaster effect unless you do daily injections, which a lot of people don't want to do daily injections. And we certainly don't want to have that up and down roller coaster effect. We want to have that gradual increase to where you're optimized at your level, and then you have a gradual fall. And then the thing with injections is it always wears off before the next shot. So this is really more geared towards our men, but men go through their own menopause. We just like to call it menopause. And so one of the last delivery methods is going to be bioidentical pellet therapy. So with pellets specifically, there's a lot of right ways and a lot of wrong ways to do it. But that's the same thing for creams, injections. If you don't get the dose right, or you are not prescribing that to the patient properly, then there can be some issues. So with our bioidentical pellets, not only is it the same molecular structure as to what your body naturally produces, but for females, it lasts on average 3 to 4 months. And then for males, it lasts on average from 5 to 6 months. So females are only having to come in to get their insertion and their hormones optimized on a 3 to 4 month basis. And males are coming in about twice a year. It is the most studied form of BHRT. So bioidentical pellet therapy has been around since the 1930s. There is literature from the 1930s all the way up to current day on why this is more of a superior method. It does provide a steady stream of hormones into the blood. So what I love about this is it's endocrine mimicry, meaning when we put the pellets into the sub-Q fat, whether you're a female, you'll have that in the upper glute area. It's very, very easy procedure. You're in and out within like 3 minutes, virtually painless. Really, the only thing you feel is a little prick to numb you up. And then we go in, make a small little incision with a trocar, and we lay those pellets in. And now you're getting those hormones absorbed over a 3 to 4 month time period. So what I like about that is when you're kind of blowing and going through the day, whether that's physical stress, emotional stress, you're absorbing those hormones within the bloodstream. When you're a little bit more sedentary at night, or maybe you're just relaxing and winding down from the day and the blood isn't flowing as much, you're not absorbing as much. So it mimics what your body typically naturally produces. Even if you're not producing any, I think that's another kind of misconception too, is when we take synthetic hormones, that actually stops your body's natural production, even if you're producing just a little bit. With bioidentical, all we're doing is we are adding on top and helping what your body is naturally producing. So we're not stopping the body's natural production. We're just adding to it and getting you back to those optimal levels when we were young. Individualized dosing. So all of our dosing protocols are extremely conservative because obviously once the pellet is inserted into that sub-Q area, it is going to be absorbed. So that is not coming out. So dosing is a massive part of that. And we've really been able to get that down to a science. So it's extremely individualized. It takes in your the patient's date of birth, age, weight, height, gender, ethnicity. What is their medical data? Does that patient a chronic pain patient? Have they had a hysterectomy? Are they currently on testosterone or estrogen? Are they PCOS? So it asks all these little medical history pieces, in addition to taking into account all of their lab data, very, very comprehensive, and then all their symptoms and activity level. Because again, it's going based off cardiac output. So if you have someone that's more active, they may absorb that a little bit quicker, and someone less active is going to be able to expand that therapeutic arc. And then, like I mentioned, is entered into the sub-Q area of the upper glute, and typically takes about 2 to 3 minutes for the insertion. No, stitches or anything crazy like that. You just get a nice little steri strip, and you are back to your day to day. So, like I mentioned, if you're someone that has listened to this entire conversation, you're like, holy cow, that is me. All those symptoms I deal with on a daily basis. I went to my PCP recently or my gynecologist recently. I got my labs drawn. They told me I was normal, but I don't feel normal. So, when we talk about, we just went through all the different modalities, let's talk about what makes the Evexias method just the superior method when it comes to pellet therapy. And the first thing is our patented pellet. So we have created our pellet specifically with you as the patient in mind. We want to give you a more comfortable experience, but most importantly, we want to give you a good quality product. And that is coming from our formulated in our 503B FDA registered outsourcing facility. So those pellets are formulated through our FDA registered facility, and they are also all tested to ensure potency, purity, and efficacy. Just a little fun fact for you, if you're someone that has had a brand name product before, did you know that it could have up to a 10% variance? Meaning if you're getting prescribed 100 milligrams of progesterone, you're either getting 90 milligrams or you're getting 110 milligrams. So that can have some of that overdosing and underdosing kind of spectrum. Now, when you're talking about generic names, you can have up to a 30% variance, meaning if you're getting prescribed again 100 milligrams of something, you're either only getting 70 milligrams or 130 milligrams, meaning you're being overdosed or extremely underdosed. So we want to make sure that when we formulate these products, that they are being tested to ensure a very, very tight variance. That way, when you are getting prescribed a medication or a product, you are getting that exact dose. We do have anti-inflammatory ingredients in our products. So that's just, again, going back to having you in mind to give you a better experience. We do have more enhanced comfort and better sustained and steady dosing throughout the treatment cycle, meaning that you're going to be feeling good the entire time of your therapeutic arc. So, like I mentioned earlier, females are able to go about 3 to 4 months. They're getting pelleted about 3 times a year, and males will go about 5 to 6 months, which is about 2 times a year. They do get a lot more of a dose. That's why they come in a little bit later, because it extends a little bit more. But one of the most important things is to make sure that you are finding a provider who truly understands and is highly trained in the art and the science when it comes to hormone optimization. Like I mentioned, hormones are who we are, and we don't want those hormones out of whack more than they already are. We want to get you feeling good again, living with vitality, getting in shape, feeling good, having that extra pep in your step. And the only way we can do that is to ensure that you are going to a provider that can really, truly get to the root cause and really, truly understands how to manage you and get you feeling like yourself again. So if that's something that you're interested in, you can head over to evexias.com. That's EVEXIAS.com, and go to our provider locator, enter your zip code, and you can actually search for our Evexias providers in your direct area. We want to make sure that you get on a path towards chronic disease prevention, on a path towards symptom relief, and really on a path towards a new and better you, feeling like we once did, with just joy and just feeling good. So I'm going to go ahead and leave it there. I think I've talked your ear off enough. I really wanted to say thank you so much for those that are still on, for staying through the entire presentation and listening to all of the information that we had for you today. If you are wanting to learn more, like I mentioned, you can head over to our website at evexias.com. That's EVEXIAS.com. Put in your zip code in our provider locator and find an Evexias provider near you, and just get on a path towards optimization for your health and for your vitality. You can also reach out to our admin, Kayla Lear, if you have any additional questions or want to be directed to someone in your direct area. So thank you again so much. I really appreciate everyone for joining us. Menopause, again, it's something that we deal with, but we can go through it together, one, but most importantly, we can really help relieve some of those symptoms in that transition so that you can still feel good going through that part of your life. So again, thank you so much. I'm going to end it there, and I hope to be back soon. Have a great one.